Simone Gold, MD, JD, is an experienced emergency physician and an attorney, and the visionary who led the pivotal press conference event that broke the spell of the coronavirus panic in 2020. Creating the most viral moment in modern media history, Dr. Gold became the founder of America's Frontline Doctors, AFLDS, the nation's leading medical and civil liberties organization. Dr. Gold is also a mom, the CEO of goldcare.com, and a best-selling author. She graduated from Chicago Medical School before earning her Juris Doctorate degree at Stanford University Law School, and then served minority communities as an ER doctor for over 20 years without a single malpractice complaint. She's worked in Washington, D.C. for the Surgeon General, as well as for the chairman of the U.S. Senate Labor and Human Resources Committee. I see her as one of the leading lights for liberty during the COVID pandemic, bringing truth, wisdom, and scientific clarity where we most need it. And now she stepped into a new role to help fix the out-of-control costs of healthcare. Welcome, Dr. Gold, to the Economic War Room.
Thank you so much. Happy to be here.
So glad to have you. You are such an overachiever. I mean, who goes to medical school and then goes to Stanford for law school? That's crazy.
Yeah. Someone who had to distinguish themselves in their family. I came from a family of doctors.
Oh, well, you did it. Congratulations. Hey, look, we've been in a few fights together regarding free speech and medical autonomy and things like that. What I admire most about you is your passion for individual liberty and the values of Western civilization. And both of those were tested sorely during the pandemic. How did things go so wrong?
I think we've been lulled for 2 to 3 generations as Americans that it's always good, it will always be this good. And we fail to teach our young that it's costly. It requires education. It requires some fortitude. You know, we took out teaching the children the Constitution. We took out the Pledge of Allegiance. We had a false Supreme Court ruling that said God couldn't be in the classroom. This is all false. So we went the wrong way for about 2 generations.
Brainwashing, but it got to the point to where people were willing to accept that there's no early treatment. You get COVID, you just go home and either die or get put on a ventilator or you'll get better. There was no early treatment. And you stepped up and said, no, wait, people do need, when they're sick, they'd like to have a physician.
Listen, I'm so sorry, Kevin. We became a culture that just bowed to the experts. I gave a talk in 2021 called The Religion of Public Health. We just kind of started bowing down to the gods of public health as though it was a religion, as though it was something you had to convert to. It made no sense. It was disheartening as a physician to watch other physicians fail to help patients. Never in my career did I ever think the day would come that a doctor wouldn't give a patient medical treatment. Never could I have imagined doctors saying to patients, "You're not that sick, come back when you turn blue," or that they would give them lethal medicines like remdesivir. It was astonishing.
Well, America's Frontline Doctors broke the spell, and you're the founder and the chairman of that group, providing liberty, health, and justice. So we've lost our medical freedom, but you're bringing it back.
Yes, this is critical. You know, when people think of medical freedom, perhaps they think it's over here in a corner, but actually it's foundational. Religious freedom, economic freedom, these things all are required for us to live in freedom. But if you're afraid, you will willingly give up your freedom. Most people will not willingly give up their freedom unless their life feels threatened, right? Life, liberty, pursuit of happiness. It's in that order. People are so afraid of their life that they'll give up their liberty. And I'm here to tell you that you can't. Your medical freedom is as important as your religious freedom, economic freedom. If you don't have the wherewithal to make decisions over your body or your children's body and your children's health, then you don't have freedom at all.
Well, we went through that to where we were losing our freedoms. A few courageous people like yourself stood up. You paid a price for it, but you stood up for us. What would you say the takeaway we should never forget from the COVID pandemic?
Oh, my goodness. First of all, you have to stop listening to experts. You have to think for yourself. There's just no substitute. Henry David Thoreau said, if you don't think for yourself, others will think for you, but not of you. You must think for yourself. That doesn't mean you have to be an absolute expert on everything. Of course not. But you have to find reasonable, sensible voices that you understand and agree with, yours being one of them, hopefully mine being one of them. You cannot let the so-called expert class dictate to you. And by the way, this is true across the board. It's true with finances. It's true with what they want to tell you about central bank digital currency and all of that. So number one, you make up your own mind. Number two, don't live in fear. We're told we don't have a spirit of fear. Don't live in fear. When people are trying to convince you out of fear, recognize that that's a tool that, negative people with negative intention use. So don't live in fear.
Oh, and we can never forget that freedom matters. And you have a Freedom Summit coming up in Dallas on September 27th. It's available for in-person. You can come to Dallas and participate, or it's online. It's called Freedom Summit 2025. Do you mind? I want to play the sizzle reel from your show.
The fight for medical freedom is far from over. Despite hard-fought victories, the battle against overreach and coercion rages on. There is much work left to be done. This September, in Dallas, Texas, the brightest minds in science, medicine, and policy unite for a critically important summit, an imperative gathering for our freedom and civil liberties. These leading experts, patriots of truth and reason, gather to defend the cornerstone of our nation, the right to choose. This is more than a conference. It's a call to action. Every voice, every idea, every courageous insight will help fuel the momentum America needs. Come listen and learn about what lies ahead for the country and what needs to happen in order to secure a future where our freedom prevails. Join us on September 27th, in person or online. Freedom Summit 2025. Reserve your spot today.
So that looks exciting. What an amazing conference. You've got great speakers, incredible lineup. We've got about a minute left before we take a break. Tell us about, from your perspective, why this conference is so important.
I get questions every day about, what do I do? How do I find a doctor who's going to tell me the truth? I saw what happened during COVID. I'm not sure what to believe, right? So we are here to provide answers. We're here to give you great information. All of our doctors and some lawyers as well have been in the fight and have nothing to gain other than sharing their wisdom and their truth with you. We're not paid by Big Pharma. We're not paid off by the government. It's just amazing information. This is the second time we're doing it. The first time we did it, everyone sat there for like the whole day. Nobody would leave. I thought, there would be some attrition. Some people would leave because it's a lot of intense, information. Nope, it's fantastic. It's well worth your time. If you're a parent, if you're a grandparent, or your own health, you want to know what's going on, we've got you covered.
All right, that's fantastic. I want to hold you over for the next segment, but we do have to take a break. When we come back, I want to talk about healthcare today, because you've got a means to make it more affordable for the average family. Healthcare costs are skyrocketed. They've gotten almost impossible to manage, but you have a solution. So you'll want to absolutely stay tuned to hear from doctor and lawyer Simone Gold with her solution to the severe healthcare cost crisis we're facing. We'll be right back. In uncertain times, finding stability in the economy can feel challenging. But what if you could navigate economic volatility while honoring your biblical values? At Timothy Plan, they believe this balance is possible. Timothy Plan filters its volatility-weighted ETFs and family of mutual funds through a biblical pro-life and pro-family lens, so you can see competitive returns and moral responsibility, helping you to weather the economic storms. With Timothy Plan, align your investments with your values while adapting to our ever-changing culture. Since 1994, Timothy Plan has been recognized leader in biblically responsible investing. Timothy Plan, your bridge between faith, finances, and the future. Visit timothyplan.com or call 1-800-TIM-PLAN or 1-800-846-7526. Investing includes risk, including possible loss of principal. Before investing, carefully consider a fund's investment objectives, risks, charges, and expenses contained in the prospectus available at timothyplan.com.
Gold holds its value far better than the US dollar. Let's see what happens when I go in this sweet shop and pay with gold. Can I pay with gold?
You can wait. Find out how much it costs.
Do you know what? Basically, do you know why I'm even using gold?
I do not.
It holds its value over time, but it's a bit difficult to spend, isn't it? Do you take this?
Yes.
That's MasterCard. Yeah, but I'm actually going to pay with gold, believe it or not, using this. That's my MasterCard, and it's linked to my gold wallet. So let's just watch that. Authorizing. Yeah, add a tip.
Thank you.
So this is your store?
Yes, sir.
And how much gold did I pay?
0.2243 grams.
Yeah, success. Bought with gold, paid with glint.
I hold in my hand The Great Influenza. This is a New York Times bestseller. This is a book that was published about it says, deadliest pandemic in history, which was the Spanish flu of 1913. I read all the way through. In the afterword, the final comment was, those in authority must retain the public's trust. The way to do that is to distort nothing, to put the best face on nothing, to try and manipulate no one. Lincoln said that first and best. He said a leader must make whatever horror exists concrete, only then will people be able to break it apart. You, Dr. Gold, you told people the truth, but our government was not telling us the truth. They were lying to us, and our media was parroting those lies. How come we lost that memory from 1913? How did that disappear, and what should we be doing about it today?
I mean, I say the same thing. A lot of people said really all of our institutions have been captured. Seriously, like our academic institutions, media worst of all, but really all of the medical schools, the law schools, the judiciary, we've seen it in every area. And people, I think, are generally good. And I think people in America, because life has been lovely, are a little bit gullible, a little bit naive, right? Immigrants didn't quite believe this the way native-born Americans believed it. So we think, oh, the government's good, the government's trustworthy. We haven't looked back at history. Governments are not good. Governments are not trustworthy. Governments are composed of people. We have, humans have a lot of duality inside of us. We have a good and we have an evil. And if you let government go unchecked, it will run ramshot over you. So I think what happened was a lot of agencies and institutions got captured in the same direction. And it's a tragedy to me that the physicians themselves didn't stand up for their patients. That I thought was a day I'd never see.
Well, it was sad to question whether or not, if I went to the hospital, am I next thing going to end up on a ventilator or with some drug that I don't want, or forced vaccination. It's kind of crazy. But now we have RFK as the head of HHS. Does that bring you hope? What are your concerns? What do you like about it?
Yeah, absolutely. People should have a lot of faith in Bobby Kennedy Jr. I know him quite well over the last 5 years. People sometimes say he's not moving fast enough. And my answer to that is Big Pharma runs the federal government, not the other way around. I mean, he's got an unbelievably difficult job, and he's not going to forget about the vaccine issue. People are worried he's all focused on food, not on vaccines. He absolutely will not forget the vaccine issue. I want to share with people, just today, our Surgeon General in Florida, Dr. Joseph Ladapo, committed publicly with Governor DeSantis' authority that they are going to get rid of any vaccine mandates in the state of Florida. And I want to remind people that Dr. Ladapo was one of the first frontline doctors. So there's a lot of hope on the horizon. There's a lot of leaders that are standing up, coming forward, speaking the truth. And this is in the best interest of Americans. We are a hardworking, lovely people, and we need our nation to be the most it can be. And that's with Lincoln's words, which is not to pretend is one way, but just to face the truth head on, and we'll find solutions.
Oh, that's fantastic. You've seen medicine change a lot during your career. I mean, when it started out, medicine was at the individual level and the patient came first, but now it's turned into something like a big business. What are your thoughts on that, and how do we get back?
Right, absolutely. There's a lot of problems. One of the things, the thing the person can do most, the individual has to pay the doctor. Don't mean to be too crass about it, but there needs to be a doctor-patient relationship. And if you want to know for sure your doctor's working for you, it has to be a relationship just like a lawyer and a client, or an accountant and a client, or a realtor and their client. We need doctors and patients to be on the same team. What has happened is doctors have become employees of big government or big corporations, either big insurance companies like Kaiser, or they work for a big group that takes a lot of money from Blue Cross and Health Net, et cetera. And then you are just the person sitting in the waiting room and in the office, and you think that the doctor's working for you, and actually they're not. That all came to light in the last, COVID years. My father was a doctor, and in those days, my dad's day, 85 to 90% of doctors were small business owners. Today, it's about 5 to 10% of doctors are small business owners. That is one practical thing that could change, is you take control over the doctor-patient relationship.
Oh, that's fantastic. I just interviewed Bob McEwen for Pirate Money Radio, the sister program to this one, and we talked about first-party pay, second-party pay, third-party pay. First-party pay is where you're consuming and paying for it. That's the best. You care about quality and you care about price, and you get the best of both. Second party, somebody else is paying for it and you're consuming it, or you're paying for it and somebody else is consuming it, and you either worry about price or quality, but not both. Third-party pay is where somebody else is paying for it and they're in charge of that decision. So you don't care about quality or price, and all government purchases are third-party purchases, and so much of our healthcare is purchased by the United States government. All right, I want to jump for a second, and I want to get back to this because I don't want to miss your solution. It is one of the most brilliant solutions that we have, putting the doctor and patient back on the same side of the table. But before we get there, what about the role of diet and food supply and the overemphasis on pills and surgery? What can Americans do differently at personal level decisions that would impact their health?
Listen, it's both good news and bad news. The great news is it's in your control. The bad news is it's in your control. Right? There is no quick pill. There is no quick fix. So you have to, there's never going to come a day that the human body doesn't need good, healthy nutrition, a good night's sleep, and you have to move your body every day. That is as old as humanity. And we keep trying to tricking Americans and being like, oh, you could take this pill, this surgery. It is false. It is not true. So I'm here to tell you and be a truth teller. The good news is it's free. You can access ethical advisors, for example, that can help you on that journey, because it's not easy to change lifelong habits. I'm not at all saying that, but it has to be done. And anyone who tells you anything different is not speaking the truth. There is no profit motive really for doctors to tell you to eat well and to move your body. So we just need advisors to help you along in that journey. There's a huge pharmaceutical industry that is geared up to sell you drugs. You know, the top drugs that are being sold, you know, Lipitor and antihypertensives and antidepressants. All of these things can be reduced or eliminated completely with changes in lifestyle.
You know, that scary thing is, I met with someone recently and said, well, I took a pill for this, but it caused this problem, so I had to take another pill for that, and that caused this problem. I took another pill for that. And if they had just lost weight in the beginning, it would have solved all those problems. But it's harder to lose weight because I think even our food industry is working against this. But Secretary Kennedy is on that. What are your thoughts on that?
100%. I'm not saying it's easy to lose weight. It's very difficult. Honestly, I think it's even harder for women over a certain age. It's very difficult. The most important thing you can do, everyone hearing my voice right now, you have to move your body. Literally today, right now, as soon as the show is over, go and take a walk. It's September. It's beautiful everywhere. Go take a walk. Move your body. It's critical. Once you start moving your body, you start getting more energy. You start getting psychologically uplifted. And slowly, the eating habits can change because you're in a better mood and you feel stronger and you feel more empowered. So it starts with moving your body. Then the second step is to get good advice, people on your side, not people who are pushing pills, getting paid to push pills.
All right, we're going to have to take another break, but you have a solution. I'm teased it the entire show. I'm so excited to share it. It's something we're not being paid to share this solution. This is sincere. I've heard about it from Dr. Gold for now several months, and I think it is something that every American should consider for their health benefits. We will cover this and more right after this break.
Oh, hi, I'm Kevin Sword, and I'm here to tell you about coffee. Well, not really, but I'm going to use coffee to illustrate my point. Here we have several different coffees, each with its own unique characteristics. First, we have instant coffee. This coffee pretends to be coffee, but it's not really coffee at all. It's a fraud. Plus, it tastes terrible. I'm out. Next, we have woke coffee. Their coffee actually tastes pretty good, until you find out that when you drink it, you have to admit that you've oppressed other coffees in the past. Insanity, I'm out. Next, we have Big Tech Coffee. Now, these guys used to encourage folks to share with others what they thought about their coffee. But now, if you say you don't like Big Tech Coffee, they'll take away your coffee pot. I'm out. This brings us to Patriot Mobile Coffee, right? This is one big cup of truth and freedom. There's no fraud here. Patriot Mobile is America's real Christian conservative wireless provider. Patriot Mobile gives back millions of dollars every year to organizations that are on the front lines fighting for our freedoms. Patriot Mobile offers the best nationwide 4G and 5G coverage on the same networks as the other major carriers. So you'll get the same great coverage, along with 100% US-based customer support, while knowing you are supporting a company that shares your conservative values. Switch to Patriot Mobile today by visiting patriotmobile.com or call 972-PATRIOT.
We're speaking with Dr. Simone Gold, and we're talking about the healthcare industry, and we're talking about Americans' health and how we can get back in better shape. COVID exposed so many flaws in our system, and Dr. Gold looked at all of those, put her attorney cap on, put her entrepreneur cap on, put her doctor cap on, and came up with a solution. What would you tell the majority of Americans who find healthcare to be completely unaffordable today?
So healthcare is not unaffordable. Paying your health insurance premiums is absolutely unaffordable. The average family of four spends $2,000 a month or a little more to have what they think is a financial safety net. I am viscerally opposed to that. I want to share with everybody that for more than 10 years, I have not had health insurance. I start with that because it's a shocking statement. People can't believe you can live in America safely and responsibly without health insurance, but of course you can. We've been led to believe something that's false. You mentioned the first, second, and third order of purchasing. You are completely correct. Medicine insurance used to be kind of second order. Now it's third order. There's no connection between the premiums you're paying and the quality that you're getting. During COVID, but I always thought the stopgap was the doctor. At the end of the day, the doctor would never do something bad for the patient. Well, COVID blew that right up. And we saw that doctors did the wrong thing for their patients. And this was too much for me, Kevin. And I said, we have to come up with a solution that's affordable for everyone. Every single person can afford goldcare.com. We actually price it $10 a month because the majority of what we do is education. It's kind of like having an Amazon Prime subscription or,
I want to interrupt you. You said $10 a month. You didn't say 1,000. You didn't say 800. You said $10 a month. Explain what you can get for $10 a month.
The reason we did it exactly like this is I want everyone in the country and everyone across the world, because it's international, come to Gold Care, and for $10 a month, you get all the information you could want. We have our own AI, for example. We have wellness videos. We have newsletters. We have informative articles, and it's all done by unbiased sources. We put together medical doctors, naturopathic doctors together. That doesn't exist in American society, medical and naturopathic. All of that is available for being a member. If, in addition, you'd like to have an appointment with the doctor, then you pay extra for that doctor visit, and it's very competitive rates.
But it's a fee for service, right?
It's fee for service. About half of our members have never even seen a provider. They just come to us because they want all that access. Last night, for example, we did an amazing town hall on the statins and the lipid, all that theory. I'm sure you've heard a lot about that. We do this every month. We do these medical town halls. Next month, later this month, right, the transgender shooter, right? And what are the effects of SSRIs and antidepressants on youth and the transgender movement? So we have town halls on every subject you can imagine. All the cancer treatments, like, is chemotherapy the right solution for you? Is ivermectin good? All of that's for the membership, because I want to get people off that concept that they need this really expensive intervention. Sometimes you do, and we've got that. We've got all the traditional, pharmacy, lab, x-ray, et cetera, but mostly we want to help you kind of wean yourself off the system a bit. Please come join us at goldcare.com.
Well, the whole information thing is the important thing. And
Exactly.
The problem has been, you're a mom, and so you know every mom in America, when they lost faith in doctors, which so many of us did during the pandemic, then you have Dr. Internet. But the problem with Dr. Internet is that you can go in and you find bad information as well as good information, and you don't have the background, the study, the education to determine and separate what is true and what is false. And so you get caught up in this vortex, and you might be doing the exact opposite of what you ought to be doing because you read bad information.
We have a vision of how medicine will be in the future. I'm certain this is how it will be. When you come to goldcare.com and you spend $10 a month, you're then presented with two sides. Do you want the information or do you want an appointment? And frankly, most of our people use information most of the time because they really want to understand, what about statins, or what about antidepressants, or do I need to be on this blood pressure medicine, or can I lose weight? Is there a weight loss class? We've got faith classes, spirituality classes, and all that's included as a member because we really want to be alongside you and help you get well and help you get better. On the other hand, if you need a doctor, we've got all those doctors too. So it's a really new way of accessing. And then the last part, which is why we're, on Economic War Room, I want to stop Americans from throwing good money away. I mean, $2,000 a month? Heck no. I quit that 10 years ago. We teach you how at Gold Care. You take one of our free classes. There's no sales. Just take the class and we'll teach you exactly to do what I did, which is to be done with the healthcare system. Not only should you be done financially, so you have $2,000 in your pocket every month, you have freedom of choice. You can see whichever doctor you like. I mean, we've got all the answers.
Well, that's a $250,000 wealthier, and if you'd invested it, you're probably $500,000 wealthier today by not spending all that money. And I'm not telling people drop your insurance. And if your employer,
we teach you how.
But the problem is that insurance was created because government had overstepped its bounds and told people how much they could pay their employees during the war. Oh, you can't pay your employees anymore. Or what do we give them that would be valuable to keep them on our team? Give them health insurance. And then you broke that bond between the doctor and the patient. And that's our government stepping up too much and being too involved. Now you're giving people a way off. It's a path out of this racket.
You know the background. Almost nobody knows what you just explained, but you are correct. Everyone needs a financial safety net if you have a job or you have any assets. So that is what health insurance is supposed to be, but that is not what it is. It is not your financial safety net. First of all, when you pay the amount you had to pay if you have an event and you pay it that year, it starts again on January 1st. And you're another $15,000, $18,000. Your deductible is never your deductible. It's about twice where your deductible is when you actually do the math. So it is not a financial safety net. So if it's not a financial safety net, why do you have it? We'll show you how to have a financial safety net over here and how to access good information and doctors over here. They're not the same.
Okay, I'm not the doctor. I'm not a lawyer. That was a doctor and lawyer who just told you that. Dr. Gold, you're doing tremendous work. You're enlightening people. You're giving them an off-ramp to this insanity that really, it was ramped up under the Affordable Care Act, which is the worst named bill in history. All right, you've written books, you have a Substack and an X account. Where do you suggest people go to follow you?
Please follow me on X, Dr. Simone Gold, Dr. Simone Gold. Please consider my latest book, Selective Persecution, Amazon and anywhere books are sold. Also, in a couple of weeks, I have a third book coming out, which is kind of amazing. And so just kind of follow me on X.
What's
and you'll
the name
find
of
it
your
all.
new book?
The Plot Against the Kids.
The Plot Against the Kids.
A true COVID tale.
All right, you've taken bold steps with Gold Care. You've took bold steps with AFLDS. You've taken bold steps standing up to the government, standing up to the healthcare system, and you're still standing. California came after you, and then they had to drop what they came after you, and I love it. So don't forget, she's got an upcoming AFLDS Freedom Summit on September 27th in Dallas, and we're going to summarize everything we've covered in our free economic battle plan. If you're signed up, if you're not signed up, sign up at economicwarroom.com. Remember, what we see as a marketplace are enemies. They view it as a battle space. This is Kevin Freeman from the Economic War Room.